Hey YouTube, so this video I'm making is going to be a video going over the criteria that one will need to meet in order to be considered a candidate for deep brain stimulation for their severe treatment-resistant OCD. So as you can see here, I'm on the National Library of Medicine, National Institute of Health.gov website, and here's their article, Who Qualifies for Deep Brain Stimulation for OCD? So here they're just talking about a trial they did, and then they're just talking about giving an introduction about OCD and the trial that they did. And here's something I wanted to read to you. They say patients with intractable OCD remained very severely ill and impaired despite first and second line treatments. For them, neurosurgery, stereotactic ablation, or deep brain stimulation. So stereotactic ablation is neuroablactic surgery such as the gamma knife or capsulotomy. But in this instance, we're talking about deep brain stimulation, DBS. So for them, neurosurgery, DBS, may be an option. Both kinds of procedures alter activity in neural networks implicated in the illness. DBS, in contrast to ablation, is generally reversible. So, given significant risks and burdens imposed by either approach, prospective patients must meet high eligibility thresholds. Estimates of how many OCD sufferers are surgical candidates vary widely, as indicated by a recent controversy over FDA humanitarian approval. So, for those of you who don't know, the deep brain stimulation procedure for OCD is actually not approved by the FDA. Like it's saying here, it has a humanitarian device exemption, HDE, for DBS for OCD. So this procedure is approved via this humanitarian device exemption, but it's technically not approved by the FDA. So it is considered an experimental procedure. Therefore, insurance companies oftentimes will refuse to cover the cost of the procedure for patients because they refer it to being an experimental procedure and that it's not proven to officially help OCD by the FDA. But there are lots of studies online proving that deep brain stimulation is indeed an effective treatment modality for severe OCD. I can actually, if you guys want me to, go into some articles and kind of dissect the research and talk about the study results that have come out recently. There was a recent study published earlier this December of 300 patients who saw very significant relief in their OCD symptoms with DBS surgery. But anyways, here's the DBS inclusionary criteria for DBS for OCD. So inclusionary criteria: 1, a primary diagnosis of OCD as diagnosed by the SCID 4. I believe that's a 4. My Roman numerals knowledge isn't perfect, but I think that's 4. 2, OCD symptoms judged to be of disabling severity as indicated by a Yale-Brown Obsessive Compulsive Score, or YBOC, score of greater than or equal to 28 out of 40. 3, significantly impaired functioning as indicated by a GAF score of less than or equal to 45. 4, previously stated severity and impairment criteria must be met in spite of at least 3 trials of different SRIs. So here's the SRIs they list for OCD. You have fluvoxetine, sertraline, fluvoxamine, paroxetine, citalopram, escitalopram, or clomipramine. Let's see. It says use of any of these for at least a month, or any reported use of citalopram or escitalopram for OCD is counted as a trial. So you have to use one of these medications for, or you have to have 3 trials of each of these medications to have or to be considered for deep brain stimulation. I don't think you have to be on all of these medications, but you have to at least, it says at least 3 trials, so I'm assuming that's at least 3 of these medications. It is saying that These trials may include any of the agents above, but must include an adequate course of the drug clomipramine. So clomipramine is a medication for OCD. I was on that medication for 3 months. It didn't do anything for my OCD. In fact, it kind of made it worse. So anyways, this is a requirement that you must have been on an adequate course of clomipramine as deemed appropriate by your neurosurgeon and psychiatrist. 5. Use of a neuroleptic and a benzodiazepine for OCD for at least 1 month. So benzodiazepines are the kind of like typically they're anti-anxiety medications like Xanax, clonazepam, Ativan, Valium, those types of medications. And the sixth and final criteria for inclusionary criteria for DBS surgery for OCD is adequate behavioral therapy, defined as greater than or equal to 20 sessions of ERP therapy with a licensed mental health care practitioner or somebody trained in ERP therapy specifically. So they're saying that you must have greater than or equal to 20 therapy sessions where you're doing ERP therapy. So that's very important. Me personally, I have been doing over 2 years of ERP therapy, so I met that criteria easily. But for you, if you have severe OCD and you're looking into pursuing deep brain stimulation, you have to have had over 20 or at least 20 sessions of ERP therapy with a licensed or qualified therapist. So there are some exclusionary criteria to this surgery. So if you currently or in the past have had a psychotic disorder, that can be an exclusionary criteria for you. If you have a clinical history of bipolar mood disorder, that can be an exclusionary criteria for you. If you have a current or unstably remitted substance abuse or dependence disorder, that can be an exclusionary criteria for you. Or 4, if you have a current diagnosis of body dysmorphic disorder. So for me personally, I actually do have a current diagnosis of body dysmorphic disorder, but we really talked about it with my psychiatrist, and he made sure that my body dysmorphic disorder wasn't to the severity enough to where it would exclude me from getting this procedure. My body dysmorphic disorder isn't super severe, but it does bother me several days out of the week. But there is a potential, if you have a severe case of BDD, body dysmorphic disorder, that with this deep brain stimulation that it can actually get worse with the procedure. So just keep that in mind if you do have body dysmorphic disorder, that may be an exclusionary criteria. So yeah, so those are all the criteria that are in general most neurosurgeons and psychiatrists will require you to meet in order to be considered a candidate for deep brain stimulation. So in some cases, the neurosurgeon may have more strict criteria. In other cases, maybe they'll be a little more loose and allow you to get the procedure if you haven't met all this criteria. But based on the NIH.gov, this is like the federal guidelines for like getting deep brain stimulation for OCD. So these are the guidelines. So anyways, I hope that this video was helpful for you. I know it was kind of a brief video, but I just wanted to discuss what the criteria are for those of you who do have OCD and who are pursuing possibly getting deep brain stimulation. Do know that deep brain stimulation is a last resort treatment. You have to have tried pretty much all or near all of the standard treatment modalities for OCD in order to be considered a candidate for this procedure. So do note that. So if you have severe OCD, but you've only maybe tried 2 or 3 medications and you haven't done therapy and you haven't done other things, well, then know that you probably won't be considered a candidate for this procedure. You really have to have exhausted all treatment modalities in order to be considered a candidate. So just keep that in mind. I will link this criteria website article in the description box below, so those of you can save it to your computer or your phone for reference. And anyways, I hope this video was helpful, and yeah, I hope you guys follow me on my journey with getting deep brain stimulation. I'll be posting more videos in January when I have my next doctor's appointment and when I actually have the surgery, so stay tuned.